Hi, you guys. My name is Brinley, and I am the founder and executive director of hsconnect.org. And welcome to this patient education webinar series that we are doing. And today we have UCB joining us, and we also have Dr. Stephen Dave Louie, dermatologist, and Sydney Carter, who is a patient and patient advocate, joining us as well today. And we are going to spend today talking about advocating for yourself, shared decision making. How do you broach certain topics with your dermatologist or with your surgeon or anybody involved in your care? And what does that look like? So I think let's start by introducing everyone. Like I mentioned, we have Dr. Stephen Dave Louie here. He is a dermatologist on the HS Foundation, all around amazing person and so full of information. He constantly shocks me. Thank you so much for being here today. I can't wait to hear your input on some of this and see what you have to say.
Yes, thanks for having me, and thanks for creating a space where we can have this important conversation, because I think it can help a lot of people, which is one of the things I love.
Yes, absolutely. And Sid, you started out as an influencer talking about your HS and your journey along the way and have grown quite the following. And then since we met at the first Beautify HS project, your journey has kind of like been taken over by advocating as well. So I'm super excited to have you here today too, to talk about kind of what that journey has looked like for you and what shared decision making and all of that means to you too. So thank you so much for being here.
Thank you for having me. It's an honor to be here, like always.
Thank you. And then we have Nicole Williams, who is the patient advocacy lead at UCB. And UCB is one of the sponsors of this webinar series. So we are so happy to have you here too, because I know that UCB is a huge champion in the HS space. And you have done a lot of sponsoring of HS Connect and our initiatives and bringing light to HS. So I just want to thank you guys for being here and thanking you for sponsoring this patient education webinar series too.
Thank you so much. I'm so honored to be here and to be a part of this very important conversation.
And I can't wait until the end when we can talk more about like how UCB supports the HS community, because it's so important. So stay tuned, that'll be coming. So first I want to talk about shared decision making. So this is a term that has kind of come up lately in the medical field. We all hear about it, but what does it actually mean? So I kind of want to take a minute to hear from each of you, and we'll start with you, Dr. Dave Louie, about what does shared decision making mean, and what does that look like to you as a provider? Like, what do you expect from your patients when they're in that space?
Yes, and I'll be the first to admit, I thought I knew what shared decision making was, but then when I actually started learning about exactly what it means, I was close, but a little off. So it's been a great journey for me going and learning more about shared decision making, because there are some like formal ways to do it. But the basic idea is you've got your patient and you've got your healthcare provider. They come together and work as a team to figure out what treatment is going to work best for the patient. And so the healthcare provider is bringing in their knowledge, their training, their experience, their expertise, kind of all those facts and figures and things. And then the patient brings in their preferences, their desires, what their goals are for treatment. And when you think about it that way, that there's no way the doctor or the healthcare provider can know that without working with the patient. And I like it because it really allows both to come to the table with something. I say, okay, I can tell you about the treatments that are available, what's out there, the side effects, the benefits, all the different options. But then we need to talk about your life and what's going to work best for you. And, are we talking about an injection, a pill, a treatment that happens in the office, in the operating room? What are your goals? And so I really love shared decision making in the sense that it brings the two together as a team, because that's really when we work best, is when we work as a team.
So do you, just out of curiosity, because I felt like I kind of knew I was on the same, train that you were on. Do you think that this is like kind of a newer thing when it comes to working with providers versus like the way it's been in the past?
I think it is. So if we go way, way back, we used to have what we call the paternalistic model of medicine, which, paternal is like father knows best. And that was the old way where you just go to your doctor, they tell you what you're going to do and you have to do it. And they don't really ask for your input. And that was the traditional way of like, oh, the doctor's an expert, tell me what to do. And then with time, we said, all right, patients need more autonomy, more decision making of their own, because if I sit up here and tell you, all right, you're going to take this treatment, you're going to do this and this and this, and then you go, well, I can't do that treatment because of X reason or this, then you go home and go, okay, that's not going to work. So we've really moved in that direction. And I think it's good to know that we don't always use shared decision making for everything. So if there's like one treatment that's perfect, we just talk about that one treatment. We might mention the other ones just to say these ones aren't as good. But shared decision making is really good when there's a few options. All of the options could be good, and it's a matter of finding the really good fit. So yeah, it's definitely been sort of a more recent movement in medicine. And that's where I think a lot of healthcare providers think they do it, and they probably do it, but there's actually, if you dive deep into it, there are like different models for shared decision making and just ways to kind of stop and think about what you're doing, and sort of that meta game of, all right, I'm engaging in shared decision making. What are the steps I'm taking, and how can I do it more efficiently or even better? So I'm excited that there's research going on. There's a lot of like psychology research that's looking at shared decision making, how it impacts patients, how it impacts providers, how it even impacts the healthcare system, because it can save money for the healthcare system when you're not wasting time and resources on a treatment that's not going to be the best fit.
Yeah, and it sounds like it's like prime for HS, especially since we're getting more treatment options coming, then it plays more of an important role in our healthcare, as HS patients. So that's excellent. I'm so glad we're having this conversation now. And Sid, for you, when you hear shared decision making, what does that mean to you as a patient?
So I think shared decision making as a patient feels like what we've been waiting for a really long time when it comes to our medical care, and it's because for a lot of average patients in the world, I think not even just in the HS realm, we put so much trust in our medical providers that they know best. And we're not saying that by including us in the conversation, we're the smartest person in the room and you don't know what you're talking about. But I think it validates the fears that a lot of patients have and wanting to know like the whole enchilada before they make a decision that can be costly. Let's be realistic. I mean, I have been fortunate enough to have great medical care, but it's a huge cost, worry for people to worry about. So be asking the questions, what does your home life look like? What financially, is realistic for you at this time, regarding not just like the cost of prescription, but I think how much time you would need off of work for this, treatment plan, or maybe we should start here. And if we end there, that would be okay. And so just asking those questions, do you have somebody to help you recover? Do you have somebody to help with childcare? How old are your kids? Including them in those kind of questions and about the treatment options available to them. I think just like you said, Dr. DeLuy, it's going to be less cost efficient on the medical system and empower the patient and hopefully empower the doctor to say, hey, look, I've gained this amazing relationship with this patient. I think when we watch even medical shows, we love when the doctor gets like just so attached to that patient. They're like not willing to let them die because they're like, oh no, like homegirl graduated college. She's the first one in her family. You know what I mean? Like they got that attachment because they ask personal questions. And so it is really empowering as a patient to be in this time. And I've been very honored to have a really great dermatologist who asked those questions and gave me all the treatment options, but said, hey, let's probably start here. If this isn't working for us, then we'll jump to the next thing that we've talked about. So nothing feels out of left field or like, where did this come from? And so it feels really good right now to be a patient with HS.
I totally agree. And yes, I second everything you just said. And Nicole, as far as, from a UCB perspective, how do you guys view shared decision making? And, obviously your role in this is different because where you stand, but just, I mean, even as a patient yourself, because regardless of what your role is with them, you're still a patient in the medical system. So I'm curious to hear from you about your perspective too.
Absolutely. And I'm going to talk a little bit about my previous role, which Dr. Dave Louie knows really well. I worked on a program called Wellness for You, and we actually created a whole platform and educational series about shared decision making. And some of the things that we found in that module when we were teaching other or teaching healthcare professionals on like how to do it, it was surprising because a lot of physicians would say, well, I just don't have time to do it. I'm just so cramped for time. I only can see patients for 5 to 7 minutes and I really got to move on. And they're afraid to ask some of these personal questions because it opens up Pandora's box. So then you're going to get down this rabbit hole that you can't get out of. So I think there is an art to how physicians, how practitioners really engage with their patients on how to ask the questions, and then letting them know that if they get into an area, maybe mental health comes up. And so there's dermatologists are not really equipped to do mental health work for patients, but having those referrals ready to go, because we know with HS patients and a lot of patients with like autoinflammatory disorders, they're going to have issues that affect the mental health. Maybe it's a pain situation that's going on that they can't get control of, or the social connectivity of like not being able to like really live their life the way that they want to. Maybe it's diet, nutrition, or even sleep. I mean, those are some important things that really from a holistic point of view that UCB really cares about. And we try to educate our practitioners on how to ask these questions and make sure that the patient's voice is heard. So working in patient advocacy, I'm all about making sure the patient's voices are heard. And it could be something very small or very large. Sometimes we do give advice to patients that maybe writing down what you want to talk about before you get in the room is very helpful with a shared decision-making model, because a lot of patients get in the room and they're like, I don't even remember what happened last week. I don't remember any of my symptoms, or now maybe the nodule or the lump underneath your arm has went down. And so, the doctor's not able to see anything at that point. So some tips like that, writing things down before the appointment, having very intentional questions for your practitioner is a very good practice.
Yeah, and it's funny that you mentioned the time thing, because through this conversation, that's the one thing that's been going through my head over and over, right? Is because everybody knows that, not based on your fault or anything, but that you're pressed for time as a physician. And so part of it, I think, in the shared decision-making thing is how can we make patients aware that this is something that they can start to expect from their providers, so that they can equally be as prepared as you are coming into the conversation about having this conversation. So I think it's interesting because for patients who haven't experienced that before, it's an odd place to be, because you're almost like, okay, what's the catch here? Like, why all of a sudden now you're asking me all these questions? And but truly, once we have a patient's buy-in on their treatment, we know that they're likely to have a better outcome. If they feel confident about the advice you're giving them, the treatment you're putting them on, we know that that's helpful for them. So I love the fact that it's about asking questions about their lives and what will work best for where they are situationally. But again, I think it's interesting that patients and do you experience this where patients are kind of like, okay, so you're asking me my opinion about something, or do you find most people really buy into it right away? Sorry, Dr. Dave Louie, that was for you.
Sorry. I think you're right. I have had people where they're so not used to it. And sometimes their gut reaction is, you know what, doc, just tell me what you think I should do. Just tell me. And I go, well, I don't even know, because I need more information. So sometimes I'll take it from sort of a more broad question to a little more directed, saying, well, would this fit with your lifestyle? Like Sydney was saying, could you come to an infusion center and take time away from work and from family to get there? Do you have transportation to get there? If we're talking about surgery, do you have someone to help with wound care at home? Because that might change our plan for how we're going to do this, or how much we're going to do at once. So sometimes it's good where you get to, the patient isn't really sure what you need from them, so you can be more specific. Or like you said, people are just not used to it. They go, and some people light up, like, good, I want you to ask me questions. I want you to, one of my favorite questions to start shared decision-making is, once we have your HS under control, what's something you're looking forward to doing again? And people always have something, there's some hobby, sometimes it's, I talked to one of my patients the other day and he said, I want to wear white pants again. And I said, I get that. I totally get that. You want to be confident and feel safe wearing white pants. And I was like, yes. So I think that's a good one. And like Sydney said, that really gets this personal connection too, where like it takes it from, we're just talking about science and treatments to your life. So, but it is a shock for people sometimes and a surprise. And like you said, sometimes I'm even greeted with, well, doc, what are you getting at with this? Where are you going with this? Why don't just tell me what I need to do? And then I kind of say, well, we got to figure out what's best for you. And I know the medical side. I need to know your personal life and what's important to you and what your life is like and what resources you have to figure out what's going to work the best long term.
Mm-hmm. Yeah, and it's such a refreshing thing, I think, because I've always said HS patients are your marathon patients, right? We're not your sprint. You don't just come in and remove, squamous cell carcinoma and you never see them again, except maybe their 1-year skin check. We're like, you're steadfast in here all the time. And it feels so different when you build a rapport with someone that you feel like they are on your team. And I feel like we tell patients that, and I know, Sid, you've heard me say this, that when patients feel like you are in tandem with them, it changes the entire game for us. And what have you experienced with that, Sid, as far as like, I know you have a great relationship with your derm, and how does that change your outlook and like the way you feel about shared decision making and having those conversations with her?
Oh my gosh, I feel so good about it. I mean, the first time I saw her, I was like, like you're so much medical trauma that you're like trying not to get your hopes up. And then she was a freaking rock star. And then she was even teaching a student. And I always take the opportunity if like any medical providers like, well, I got this group of students. I'm like, bring them in, so they can see what this is like in real life, and not in a notebook or a textbook or something. And so I was like, of course. And then just the way she explained it to her and reiterated, like, if you see somebody with these things that look like blackheads, they're actually called DEPs. And like HS patients are some of the only people who start to get those first before like, they start getting those uncontrollable sized ones. But this is not because they're dirty and it's not their fault. And so you really want to reiterate that to them. And I was like, this is a freaking like unicorn derm besides Dr. Dave Louie that I ever seen in my life. Like, oh my God. And I just start crying. And I think in that moment, she realized too that like the way you talk about it even matters. And so it's amazing. I was actually just looking up. I know she switched offices, and so somebody was asking me for a dermatologist in Colorado earlier, and I'm like, I'm gonna find her for you because when you have that moment with a derm, you want everybody else to have that moment. Like we deserve to have that safety and trust in the person who's, like you said, we're not just coming to you once or twice a year. Sometimes it's multiple times a year, depending on our treatment plan. And then you see us probably for the rest of our life. So it changes the narrative of somebody's HS story when they have somebody fighting for them in a positive way on the medical side, and you're impacting their life. And so it could be negative or it could be positive. Which one do you want to be? And so including them in the shared decision making is genuinely impacting their ways in more ways than one. So not just physically, but I think mentally too. It's a huge battle that we're starting to win.
And Sid, when you feel like you have input on your treatment plan and that you're an equal partner at the table, do you think that that helps you stick to your treatment plan and have more I don't want to use the word faith, but have more assurity that this is a good treatment plan for you? And then even maybe if it doesn't work, but that you felt like you had a say in that and that you can speak up when you're ready to move on if it's not working.
Absolutely. I mean, she gave me all of my treatment options. And I think HS is one of those things where until we started seeing more people openly share on social media, everybody's looks very different. And so I'm over here like, I haven't had a flare in 3 weeks. Look at me. Life is great. And I'm like, I don't really know if my HS is bad or not. I didn't know the stage ones, the stage three. I didn't know any of that. And so going in and asking her, well, what treatment plan do you think I need to be on? hearing her out, but then also being like, okay, well, I'm really not flaring multiple times per week, because you have your thick of like a really bad HS time of life. For me, stress was a huge trigger. And I just pray to God life never gets that bad again, to where my body flares that bad again. And so I'm like, oh, well, you know what? I know you just gave me all of these treatment options, but right now I'm kind of just like using natural things, like something that I can do that's over the counter or I can buy online. It seems to be working for me. And she's like, right, let's not fix what's not broke. Okay, if this is working for you, as long as it continues to work for you, let's do this. What the moment it stops though, here's plan A, B, and C. Like she had that lined up for me. And I know that, okay, if we get into a scary situation where I start seeing more recurrent flares, and the quality of my life starts being impacted, the way I show up as a mom and all of these things, then I know, okay, now let's go back. Maybe it's time to do an injection or a steroid shot or X, Y, and Z. So it helped so much. And it really helped that she heard me out and was like, no, I'm glad what you're doing is something and it's working. And let's keep it that way until it doesn't. And then we can, move forward. So she wasn't like, you're crazy. What are you even doing here? Wasting my time. You don't even want a prescription. She still heard me out. And so I thought that was amazing too.
Yeah, definitely. And I think that it reinforces that you feel like you're in good hands when that happens, because it isn't just a push to no, let's just do this now. And Dr. Dave Louie, what's your impression of kind of when you have a patient who engages in shared decision making? Do you feel like they tend to do better, that they're heard, or that they feel more comfortable coming to you if their treatment regimen isn't necessarily working?
Absolutely. I think from the get-go, it helps patients to be more excited about starting the treatment plan. Deep down, part of us, everybody is a people pleaser. And so even in the doctor-patient relationship, we want to please the patient. We want you to be happy, but patients also want to please their doctors a lot. So sometimes you're sitting there and they're talking about some treatment plan and you're thinking in your head, this is not going to work out for me. Like this is too much, or this is, like we said, I don't know if I can get transportation to get to these infusions, or I don't know if I can even set up this delivery for this medication because my mail supply is not reliable. But you're like, but the doctor's so excited about it. I'm just going to, listen to them and I'll try to figure it out later. And you go home and you never end up even getting the medication that we are trying to get. And so you can't even take it. Versus if we kind of talk through those things and figure it out ahead of time, then you go, okay, this is going to work. I brought up the things where I thought it wouldn't work. We had solutions, we figured it out, or maybe we changed directions for something that would work. And then, like you said, even if it doesn't work out, I think it gives people that confidence that, you know what, I wanted to try that. The doctor was willing to work with me. Let's go back. I'm going to say like, okay, that didn't work out so well. What's the next thing, or what do we do now? So I think it really does give you, because the worst is when you're kind of thinking, I really want to try this treatment. I heard some people had success with it. I've read up about it, and the doctor's like, I don't really like it. Let's not do it. And you go, well, like if you don't decide on together what you're going to do, that resentment is always going to be there, and it doesn't help anything. So it's nice to just have it out in the open. It's like Sydney said, someone who's willing to try and go like, yeah, if that's working for you, awesome, good. Let's, yeah, if it's not broke, don't fix it. And if it stops working, then we'll adjust course and figure it out together.
Yeah, definitely. And Nicole, do you have any feedback on that from like your prior experience in doing the shared decision making? Did anything research show that actually does help? Because I haven't dived into that to look at all, but my inkling would be that it would.
Yeah, I mean, patients, I think when they go to the doctor, they just want to be heard. I mean, and they don't want to feel invisible. And I think a lot of times patients feel so defeated when they leave the doctor's office, and it becomes that mistrust with the healthcare system. And that's something that we don't want the patient to feel. We want them to be engaged in their own medical treatment process. Because they do have better clinical outcomes. They can also, if they track their journey along the way, they can kind of see what triggers maybe certain flares or certain symptoms that happen when certain things happen in their lives. So I just think that when you're engaged with the decision making, the patient definitely has better clinical outcomes for the most part. And maybe it's not like a clinical outcome like a flare is reduced, but like their mental state is just better because they felt like their voice was heard. So I think that's important too. And Dr. Dave Liu, I don't know, like if you can give it some advice on like how to ask some of these tough questions. But like you just mentioned that, asking about the delivery of a certain drug to the patient's home, if you never asked that question, you never would have uncovered that there was an issue. And then you can provide a solution possibly for that patient to have like an alternative place for their shipment. But like with some of these tough questions, like how do you ask those tough questions to patients?
I think one of the ways, if you're not really sure, like if you as a provider have never even thought about asking someone about the delivery, is at least if you're talking enough about the treatment options and kind of laying things out and saying, okay, so this is an injection that you do at home. It's going to be delivered by a special pharmacy, so you won't pick it up. Then that gives that opportunity for the patient to go, oh, well, in that step, that might not work. And then at the end, you can always ask sort of, all right, how does that sound? Does that seem like it will work for you? Or you can even be really open-ended. Once you kind of lay out the different options, you can say, what do you think about those? Which one do you think would work the best for your life? And then the patient might bring up and say, well, those delivery ones I might have some problems with. So what about these ones that aren't delivered? Or how can we work around those? And then it gives you that opportunity to say, yeah, let's talk about other options. We can get it delivered to the office and then you can pick it up. Or, we can figure out a different place to have it delivered. So that's one of the things I would say is if you do a good job of sort of laying out the expectations for everything, that gives the patient the opportunity to then give some feedback and you can ask for it and say, all right, tell me, do you think that's going to work for you? What are your thoughts? And sometimes you get that, you see in the patient's face, you say one thing and then they kind of go, like sometimes it has to do with, oh, this medicine is an injection you do at home. And people go, oh, like, okay, I saw that injection might be a little scary. Let's walk through it, talk through it. Let's talk about what patients experience when they do it and how we'll be here for you. And if you need to, you can do it in the office too. If that doesn't work out, that you do it at home. We have some people who live by themselves. And honestly, it can be really hard to give yourself a shot because you know that it's going to hurt in a second. Even if it's not a lot of pain, it's going to hurt in a second and you have to do it to yourself. So some people, if they don't have anyone to do it at home, they just come to the office for them.
Yeah.
Yeah, and I was going to ask next, so you practice shared decision making. Sid, you're with a derm who practices shared decision making. What about the people who don't have physicians that are already practicing this? So how would you help patients who don't have this experience already but want to be part of this shared decision making? How would you approach a physician about that?
That is an excellent question. And I think it's sort of an opportunity for you to help your physician do an even better job. So it does require a little bit of strength and boldness to sort of let your opinions be known. But I know a lot of people are very comfortable doing that too. And hopefully your provider is making it easy and sort of asking those any more questions or, what do you think about this? But sort of advocating for yourself. So taking out where usually I'll say things, like what are the important goals for your treatment? What are you trying to accomplish? What are important considerations? Are you really worried about side effects? Are you concerned if things are natural or not? Are you more worried about how well it will work and will it work long term? Those types of things. So you can kind of think about those things ahead of time, like what's really important to me. And then research is golden. So get a couple reliable sources. So of course, some of my favorites are HS Connect, tons of useful information on the website to become a really informed, educated patient. And another one that's linked from the HS Connect website is the HS Patient Guide, which is at hspatientguide.com. Great info in there about everything HS, and it's written in language that non-doctors can understand. So it's not just all of our crazy words. But those are really great ways to kind of explore. And I always say you want to go for reliable information because we all know the internet has just a lot of stuff out there. People mean well, they're sharing their experience, but sometimes their experience does not really pertain to other people, or it might have even been sort of a coincidence that things happened the way they did. So getting that reliable information kind of lets you come in, and like Nicole said, almost have your questions ahead of time. You know, I've heard about this medication. What are the side effects of it? How common are they? How well does it work? You know, what's your experience with it? Is this something we use by itself or with other things? And don't be embarrassed if you're overwhelmed at one of your early visits, and then you kind of go and do some research and come back prepared. Like you said, it's a marathon. Don't feel like we have to figure everything out at the first visit, because there is too much. There are little things that I wait until follow-up visits to even bring up, because I'm like, if we talked about it at the first visit, I don't think you'd even remember it.
Yes, absolutely. And I think inviting somebody that you trust to come along who can help retain some of that information too, because you as a patient, you're so overwhelmed by information, even the new language, if you're new to HS, what all of those things mean. You know, there isn't a glossary per se that providers hand you. So if you have somebody who can help you retain that or take notes or write it down, I constantly am putting things in notes in my phone. I also make notes about what I want to ask too, because I feel like I can be a better prepared patient and get the most out of my visit by doing that. So yeah, I think that's wonderful. And like you said, you do have to be bold. You do have to advocate for yourself. And if you have a question, speak up and ask. It's okay to ask the same question 2 different times if you don't feel like you're getting an answer that makes sense to you. And it's okay to ask somebody to explain it differently, because it's very important that we understand what's going on with our HS and what this medication is working to try to do. And Sid, do you have anything that you would recommend too for patients about how to have that conversation, or like where does that start?
So I think just the best advice that I can give, that I would give to myself, is also to just like write those good questions down. Maybe give yourself like 5 good questions that you would like to see answered. We do want to take, note that we know everybody's pressed for time. We're all in a rush, even at the doctor's, moms are like, okay, like, can we speed this up? I gotta go do soccer pickup. Like, we don't have time to waste. So let's get straight to the point. And by doing that and asking those brave questions, and take time before you go into your appointment to fill all the fills. And I think we get so afraid because of the past medical trauma, and sometimes we ask somebody about HS and they have this coat on or these scrubs, and they're like, well, HS, what is that? Be prepared for the fact that they can have the answers to your questions or they may not. But I also would just 1000%, until I take my last breath, will tell people to go utilize the resources on HS Connect, get everything from there, because the way I have seen Brinley work so hard, I think she loses sleep at night from the amount of misinformation that circulates the HS world, and from places that we should trust, but we can't until further notice. And so utilize her resources that she works really hard to make sure are up to date and are accurate. And so that's where I get all my information. That's where you should get all of your information. And then you should go share it with a friend. So
Yeah, and it's very difficult too. I think I just want to touch on what you said about going into an appointment and feeling the feels. You know, for a lot of us, it's a very overwhelming thing to go to a dermatologist. And Dr. Dave Liu, you and I have had many conversations about this, where people start off their visits by apologizing to you for what you're gonna see. And as much as you want to assure us that it's not as bad as you think it is, or that we think it is, or that, there's nothing to be ashamed of, it's so difficult for us. And even unveiling that puts us in a really uncomfortable situation sometimes. And we know how necessary it is, but to just give yourself a minute to appreciate how hard that is. And to be proud of yourself for making that step, for being there, to want to do something to better your treatment and your life, and give yourself some more hope and some choices. And just, your doctors are not judging you. They are there to help you. They're in this field because they care about skin and they want to help you get better. And if you don't find the right derm right off the bat, that's okay. There are a lot of other derms out there. So don't give up on the medical system overall based on one negative experience too, because I think that we end up suffering needlessly for that when there are a lot of really good derms out there that are willing to help and see you through this process and work with you. So please don't be dissuaded if you have, one bad experience. You can always ask for a referral. If from that person, you can check out HS Connect has a dermatology list, HS Foundation has a dermatology list. That you can go to look for other derms near you. There are also some virtual dermatologists that focus on HS as well as an option. So I would just really encourage you not to give up if you have a bad experience. I think most of us have, and it's kind of damaged us for a little bit and made us not want to seek care, but really it just hurts us in the long run. So I think it's really important to just keep going on your journey and to like Sid said, give yourself a little bit of space and permission to feel all the feels, to be overwhelmed, to sit in the car afterwards and cry and just say like, what the hell is happening? Why is this happening to me? Those are all totally normal and okay feelings. So I think with that, I know, Nicole, UCB has been a huge supporter of HS. You guys are leaders in the space. You're working really hard to make sure that the entire person dealing with HS is recognized and not just the HS itself and the physical symptoms. So I know personally how your organization supports organizations like mine, but do you want to give us a little bit kind of an overview of that?
Sure, absolutely. So in patient advocacy at UCB, we love to collaborate with other non-for-profit organizations, specifically within the HS space. We have a great relationship with HS Connect, and we're all about just raising awareness about the disease state and making sure that we're providing accurate, truthful information. We like to support initiatives in the community as well. So some of those initiatives include patient summits, and we just supported one last weekend with Brinley's group, and it was called the HS Connect Social Media Influencer Workshop. And that was really focused on making sure people that are in the community on social media are, being able to provide relevant information, accurate information to the masses. And we know that we consume a lot of our information through social media. So we wanted to be a big supporter of that. And it was an incredible weekend. I know that so many people were emotional. They were just so happy to be in other spaces with other HS patients. That is just huge. So if I could give some advice to HS patients out there, whether you're struggling or not, I mean, I see Sydney and she is like this inspirational woman that has so much positive energy, and it's infectious. So like even either side, if you're needing support, I really encourage you to find a community of other HS patients that can help you through your journey. And then if you're at a point where you're at a high point and you're able to just provide some sunshine and hope for other patients, I encourage you to do that. I think some patients get really embarrassed. They feel certain types of shame or whatever with their disease. So if you can get out there and just give hope to other people, just normalize the disease, because a lot of people don't know about it. I was literally at happy hour last night, and I always talk about what I do for a living because I'm just so passionate about it, being on the corporate affairs team here at UCB and being in patient advocacy. And this young lady said, "Oh, I have HS. You don't even need to explain it to me." And I'm just like, really? And she actually followed Sydney on her media, Social Sid. And she's like, I'm always messaging her. And I just tell her, like, thank you so much for giving us a space that I can feel like I'm not alone. And so just having that simple conversation, and maybe there was another lady that was part of the conversation. She now knows all about HS, and she can hopefully educate some of the people within her community. But even in that conversation, she was saying some myths about the disease state. And I was like, oh, that's not really accurate. So really excited to be a part of HS Connect's initiative to really provide accurate, truthful information and really kind of reduce some of the stigma that goes along with a lot of these autoimmune disorders, autoinflammatory disorders. So that's been really great. And then we also supported HS Connect's Beautify HS project. And we took this on actually last year, and we highlighted the whole campaign at our Brussels headquarters and in Belgium. And then this year, during our HS Awareness Week, we have an internal campaign going on just to talk about the disease state and understanding what it is, what patients go through. So we've engaged a couple patients to come to our home office and really talk through their journey with different groups. They're going to be on our town hall. Brinley will be there, and she's going to be talking about the Beautify HS project, which we are going to have an art exhibit at our campus in Atlanta, Georgia. And so people can come by and just see the powerful and meaningful pictures as part of this art exhibit. So really excited about that, because I think that you can hear stories. Maybe they don't always stay with you, but sometimes if you see a picture, it can really be just part of your journey with helping patients along the way. So really excited about that. And I think they're so creative. And I just want to give kudos to Brinley for being that voice. And she is, she will not stop. She keeps going. I know that sometimes it's really hard. You have rough days just like everybody else. And I really appreciate your support for the community. And I see you as a true leader. So thank you for allowing us to be a part of a lot of your initiatives to help uplift the community.
And thank you guys so much for your support. Seriously, they take my crazy ideas that I come up with and they see the vision and they help execute. And I'm so grateful for that, because it is truly a difficult disease to live with, like we all know. And to have the support of UCB and other companies like them is amazing, and really helps elevate what we do and brings HS to another level that we so desperately need. So it warms my heart that you just met another person with HS, because again, it's not rare, it's just rarely talked about. And the amount of people who are walking around like hiding it is crazy town. And we just want all of those people to come to light and to be seen and heard and validated and educated and empowered in their journeys, and get them on the right path to treatment if they need it. So I am so grateful that you guys see, the value in what we're doing here at HS Connect, and that we have such a great partnership with you.
Absolutely. And I have to mention too, since we do have two members of the HS Coalition on this webinar, Dr. Dave Louie and Brinley are both part of our HS Coalition, which was started last July in 2023. And it's just a great group of individuals that have come together. They're healthcare professionals, as well as patients, surgeons, and really just people that are a part of the community that work on policy. So the HS Coalition is focused on, overturning some policies that are not very favorable for HS patients, but also looking at health inequities as well to help change the pathway for those patients in the community as well. So looking forward to what the HS Coalition is going to achieve this year and beyond. And thank you so much for your partnership there too.
Yes, absolutely. It's a very exciting time in HS, y'all. I know it's never a good time to have HS, but right now is the best time to have HS because of everything that's happening in the world of HS right now. So although we know how much it sucks, it's a good time if you're here. And we're just at the precipice of all that is to come. So it's a really exciting time, and there's so much happening and so much change to be made. And we have the most amazing group of change makers who are pushing all of this forward. So as final thoughts, anything you guys want to say about this? I think it's been amazing. I mean, I love the conversations that we've had about how do you do shared decision making? What is it? What does that look like? How can you bring that to your provider? Any last parting thoughts?
I'll say, I think it's important to start by, as a patient, thinking about what is important to you. Take a minute, because sometimes, like you said, we're so rushed through, and sadly, with all the medical trauma and misadventures that go on, sometimes you focus on what you don't want. And so think about like, well, what do I want? What is important to me? What is that thing I'm going to do when my HS is under control and I don't have to worry about it anymore? Because like you said, that can also give you that hope, and I don't know if you noticed, I say when it's under control. I don't say if it's under control. I say when, because we're going to get there.
Yeah.
Yes, absolutely. And then Sid, anything?
No, I just want to say thank you so much. And to all those of who, rewatch this replay, I never know where they go, y'all. But I just want to say, look at how it takes, like, I think I'm just the patient, but you guys do far more than I can. I mean, nothing that me and Brinley, she's a patient too, y'all. She will forget sometimes because she's always in advocate mode, but you guys are like, you're healing the inner parts of us when we were so broken and couldn't talk about this. And your roles and what you feel is just like your 9 to 5. I hope that it's so purposeful and it's passion driven, and we can see it in your eyes when you talk about it. It's not like, oh my God, I have to be on this meeting today. And I think we heard that through the influencers who were at the workshop, that like they love the way your guys' eyes lit up when you talked about HS, and you didn't make us feel any less than human. And so thank you guys for your roles that you play behind the scenes, because I know that it could feel like, oh, well, all those big things are happening and you had such a huge part in making it happen. And so I just appreciate you all so much for allowing me to do things like this.
Beautiful.
That
Thank you.
was so touching.
And Nicole, anything you want to add?
I mean, I work in patient advocacy, so I'm always going to say be your best self advocate. And when we were talking earlier about maybe you don't have a physician that participates in shared decision making, but maybe somebody in the office does too. Maybe you can have that rapport with the nurse or the medical assistant, and then they can get the ear of the physician that's taking care of you or the practitioner. I think it's about creating your dream team. So it's a lot of people along the way that support you to help advocate for yourself. So just don't ever give up. There's always a way forward and you can figure it out. And there's a lot of people and resources out there to help you. So I wish you well on your journey. And really, I have to commend Sydney again, because like her attitude is like everything. And I think once you change the way that you think about things and the way you approach them with your mind, really there's endless possibilities. So yeah.
Yes, absolutely. And it is a lot about changing our approach, and some of that's hard to work through. But if we can approach it with a better attitude and asking the questions, then I think, we get more of what we need out of it. And being vulnerable too is okay to say, I've had a lot of really bad experiences at the beginning of your appointment. It's okay to say that. It's okay to remind that person, this isn't my first rodeo and I'm a little bit gun shy. And hopefully that vulnerability will bring them to a better understanding of where you are too, without you having to be defensive about it, because that's naturally where we go. So I appreciate you guys so much in this conversation. It was so enlightening. And I think that so many patients are going to gain help from this and better understanding about how they can go into their appointments and get the most out of it. I did want to mention really quickly too, Papaya is an app that was created for HS. So if you're trying to track your flares and know what's going on, look up HS Papaya in the App Store. It's not available on Android yet, but that's hopefully coming very soon. But that's another great way to be able to track yourself and what's going on with your HS, so that you can actually print out a report and give it to your derm as well. Because I know it can be really hard to kind of track all of that, and our recall bias as far as what happened a week ago. I can't remember yesterday. So a week ago is a really long time. So there are a bunch of tools and things that are at your disposal to use. It's just a matter of finding out what those are. So definitely visit HS Connect, figure out, whatever you need. We pretty much have it. And if you don't, hit the contact us button and email me and I'll find it for you. Or we'll add it to the website because other people probably need it too. So again, thank you so much, you guys. I really appreciate you taking the time to be here, and all of the information that you shared has been absolutely amazing. So we will see you on the next one. Bye.
Bye.